MMT Elbow Extension Triceps. Assist the patient to the prone position with the head turned to either side. The shoulders should be abducted to 90 degrees and the elbow flexed so the forearm hangs vertically over the edge of the table. Stand at the side of the arm being tested. Passively extend the patient's elbow. Provide support just proximal to the elbow. With the other hand, extend the elbow at the distal forearm. You are not assessing the infield, you're determining how much range the patient is able to move the elbow in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to extend the elbow while supporting at the elbow joint. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include externally rotating the shoulder to put the arm in a gravity-minimized position and assisting elbow extension by horizontally adducting the arm. Observe for any motions that are not in the plane of extension. After correcting any substitutions, ask the patient to perform the motion as previously. Support the patient at the elbow. Place your other hand on the posterior surface of the forearm, just proximal to the wrist, and apply the resistance in a downward direction. The resistance is applied in a direction toward elbow flexion. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in elbow extension and holds against strong resistance. Grade 4, good. The patient completes full range of motion in elbow extension but breaks against strong resistance. Grade 3, fair. The patient completes full range of motion in elbow extension but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Position the patient in short sitting with the feet resting on the floor or on a stool. The arm is abducted to 90 degrees with the shoulder in neutral rotation and the elbow flexed to about 45 degrees. Make sure the entire arm is horizontal to the floor. The gravity-eliminated position of the therapist is to stand at the side of the patient supporting the arm at the elbow and if necessary at the wrist also. Make sure you do not resist or assist with elbow extension. Instruct the patient to attempt elbow extension. You need to observe for external rotation of the shoulder and any other extraneous movements of the arm. Grade 2, poor. The patient completes full range of motion of elbow extension. For grade 1, you must palpate the tendon of the triceps. Place your fingers just proximal to the olecranon to palpate the tendon. Grade 1, trace. Palpable contractile activity with no motion. Grade 0, no palpable contraction.